It's really great to be here and an honor. In fact, we had kind of a funny misunderstanding at the beginning. I was so intimidated when Marcia wrote to me and said, we'd like you to give a visionary talk on global women's health. And first I thought, well, I'm not visionary, I can't do visionary. And then I thought, global women's health, I'm not an expert in global women's health. I know one little thing, which is violence. And I wrote back and said, yeah, or did I just take this off? I wrote back and I said, thank you so much. I have to decline because I'm really not an expert in global women's health. And then she wrote back and said, no, I want you to talk about violence. So here we are. We're going to talk about violence. And it's really a very exciting time right now because I just came back from Women Deliver. How many of you have heard of the Women Deliver conference? It happens about every 3 years. And it's kind of incredible. I'd only been to one before. And it started out mostly talking about maternal health. But now it's just like this gigantic feminist 8,000 people conference that has a lot more than health and a big focus on gender inequality, sexuality, and very political as well. And so, for example, this is just a few people. We had the president of the new woman president of Ethiopia was there. The really awesome Canadian Minister for Women's Affairs, who is an Afghani refugee herself, and really impressive. Prime Minister Trudeau 2 days ago announced that Canada is going to be giving $700 million to a fund called the Equality Fund, which is going to be to support local women's groups who work on sexual and reproductive health. The one in the middle that says respect, I think I have a slide about this. There it is. Also very exciting. This is the World Health Organization together with UN Women and many other agencies and bilateral donors who signed on to it. And they developed a framework for talking about violence against women and for prevention. And some of you may know the INSPIRE framework for violence against children, which has turned out to be just a really, preventing violence is not actually that complicated, but there are a lot of moving pieces, and it needs a lot of coordination. So this is a way of getting everybody on board to a much more integrated sort of framework and it's based on evidence. So there's actually a page, I'm not going to go through the whole thing, but for each one of these, relationship skills, strength and empowerment of women, services, poverty reduced, environments made safe, working on child and adolescent abuse, and transforming attitudes, beliefs, and norms. For each one of those, there's now a pretty good body of evidence about at least some interventions that we know now work through randomized controlled trials or very rigorous studies. So that, and then last but not least, this new Lancet article, which maybe you've heard of it, special issue on gender equality, norms, and health, which was led by one of your own professors from Stanford, Professor Gary Darmstadt. So that was really exciting, and yesterday was the launch of it, and I was really lucky to snag one of these because there weren't very many of them. I had to crawl under some chairs to get one. But anyway, it's very exciting because it gives an amazing framework for understanding how gender norms and structures that keep women, that maintain discrimination, that maintain restrictive gender norms, how those affect health of both men and women, and what we can do to change that. So I came back very energized and very excited. We have more evidence than we ever had before. We have more funding. And to some extent, and in some places, not here, unfortunately, we have more political will than ever to address violence against women. So I thought I'd tell you a little bit about how I got started in this because it was a little bit roundabout. A couple days ago, I had an interview with some girls at a Quaker elementary school who wanted to interview me about feminism. And I was kind of excited first because I thought, well, they all know that I'm a feminist and they want to hear about, what it was like and stuff. And then a bunch of other friends were all part of the same Quaker meeting showed up and said, you know, we're just here because we're old, not because we've done anything. And when I sat down with my little group, what they wanted to know was, what was it like to live without feminism before there was feminism? And I'm like, well, actually, there was feminism when I was young, and they were really surprised to hear that. And I thought it was kind of sweet until I realized, like, how old do they think I am, actually? But it's fun, and I have, since the time I was small, I've always been an activist. I come from an activist family. My children will attest that they spent much of their childhood being dragged to rallies and demonstrations. We will hear more about that later. But I spent, and I think some of this is in my bio, I spent 20 years, all of the 80s and most of the 90s in Nicaragua. And I went there, I actually dropped out of college one semester before I got my degree, and joined the revolution, the Sandinista revolution. And probably most of you were not born yet. Does anybody remember the Sandinista revolution? Okay, we've got a couple, or you've heard about it. So I was a Latin American studies major, and I also was doing pre-med, but frankly, it was way too hard. And it was just too hard, and it was so much more work than I felt like putting in at the time when revolutions were happening and all this other stuff that I really wanted to be a part of. So I dropped out, and I went and became a community health worker on the Atlantic coast of Nicaragua. And as I say it was too hard, that's like my respect to all of you, because you're doing it, and I really do recognize that it's a huge accomplishment. So I worked for about 10 years as a community health worker, and then in the 90s moved back to Managua and got involved in doing work around gender as a gender advisor for the Swedish Development Cooperation, and I got very involved in the women's movement. And at the time, we were just building up a whole network in '92 of women against violence, and that was an issue that had not been addressed during the revolution. Basically, women were supposed to be wives and mothers of heroes and martyrs. They were supposed to help defense and raise production. They were not supposed to be talking about domestic violence. They were not supposed to be accusing comandantes of sexual harassment or assault or domestic violence. And so that was all kind of quashed down. And after the revolution ended through an election where Daniel Ortega, which we'll come back to him because he's back again, he was the president then. When he was voted out of power, suddenly the women's movement just became incredibly vibrant, because you've got millions of women who are very well organized and very passionate and really know how to mobilize. And now they're mobilizing around their own issues. And now they want to talk about what's been happening with them, and domestic violence and child sexual abuse and femicide, and they want an end to it. So we drafted a law, which was one of the very first laws, really one of the first laws in the world, on domestic violence, and went to the politicians in Parliament and said, okay, we've got this law, we really want you to pass it. And they basically laughed in our faces. They're like, you know, domestic violence, that's not even a thing. You know, that just happens to a few women. They're women who are complaining, they're making this stuff up. They have to learn how to be better wives. And they said, well, if you can give us some hard numbers, then maybe we'll listen to you. And so I took that as a challenge, and I'd always been interested in going back to school to public health. And by this time, I had actually finished that last semester and done my senior thesis, so I had a degree, which was lucky. Because I would have hated to be getting my BA when I was 35. But anyway, I got an opportunity to go to Sweden and work with a group of Nicaraguan researchers and Swedish researchers from Umeå University, who had a big demographic surveillance site in León, which is the second largest city of Nicaragua, where the most oldest and most prestigious medical school is. And we were all studying epidemiology in Sweden. And so my part of it was to do a prevalence study. And nobody in Latin America, there were a couple studies, but not very many, basically nobody had been asking the question, how many women have actually been abused? And a lot of people thought you couldn't even ask it. Like, how can you go to somebody's, knock on somebody's door and ask them, does your husband beat you? And it, did sound hard. But we talked to some of the people who had done it. We read a lot about it. And we came up with a methodology that worked for us. And we did do a random sample of almost 500 women. And we interviewed them very carefully, with a lot of privacy, with very well-trained interviewers, and asked them about specific experiences of physical and sexual violence by an intimate partner. During their lives, during the last 12 months, we looked at severity, and we also had some data on sexual assault. And what we found out was really shocking even to us. Oops, I'm going to do this one first, and then I'll go back. We found out that 52%, or 1 out of every 2 women in León, and everybody agreed that León was very, actually represented Nicaragua very well. It's a pretty homogeneous country in general, except for the Atlantic coast. So it was like, this was taken as something that was credible and true for the country. 1 out of every 2 women had experienced violence by a partner, and 1 out of every 4 had experienced it during the last year, so 25%. When we looked at the police data, we found, the administrative records, we found that only 3,000 women had reported violence during the last year of '95. And when we extrapolated this, we realized that it was actually more like 250,000 women who had experienced violence, and only 3,000 had come forward. And this is just good to keep in mind, because when we look at indicators for violence, and you're looking at resources like police reporting and all of that, you always want that to go up. If going up means that finally women are, feeling like they can break the silence and they can come forward and they're feeling more confident. Going down is what you don't want. It's never going to reach. You're never even going to get close to a large fraction of the number of women who are actually experiencing violence. So when we showed this, it was actually very compelling. We also did a lot of nested epidemiological studies. So if you're looking at violence and low birth weight violence and maternal mortality, and we did a child mortality study, we found that women who had been abused, using a population-based sample and a case reference study, we found that women who had been abused physically or sexually were 6 times more likely to have lost a child up to before the age of 5 and before the age of 1. And we think that that's very linked to the neonatal mortality, which is the largest cause of child and infant death. And we did several studies also looking at cortisol during pregnancy, and finding that abused women had elevated levels. So the babies were small for gestational age. And so we were able to just do a lot of different kinds of studies, not only showing how common violence is, but also how devastating it was for women's health and children's health. This is one of the lines, this was one of the narratives that we got from one of the women we interviewed, who talked about she'd been abused by her husband really brutally for many years. From the time she married him at the age of 15, she used to have to climb over the walls and sleep in the neighbor's backyard to escape him when he came home drunk, and he would be shooting at her. She'd go to the police, but they would take her home and say, be a better wife. And and basically everybody told her this is what life is like. Her mother and her mother-in-law both said, he's the father of your children. You need to stick with him. All women go through this, all the things that we hear about in sort of traditional families. And her grandmother's the one who said to her, what are you going to do with candies in hell? You're going to be dead. And all these sweets that he brings you, whenever they'd make up. He'd beat her and he'd go away, and then he'd come back and he'd bring her candies and chocolates and clothes and all this stuff and say, forgive me, and it won't happen again. And the grandmother said, what are you going to do when you're dead with all of this? And that's really what made her change her mind and realize that she needed to get out. So we used her story and we named the research candies in hell, which is a kind of very traditional Nicaraguan phrase for something that is too big a sacrifice. And so her story became, we had the data, and we had this really emblematic story that people so identified with Ana Cristina. We presented the findings not only in peer-reviewed journals, but we presented them in all sorts of different formats, in popular women's magazines, the Boletina. We did another version that we did for the mayors and for the ministries of health and parliamentarians with more of the data. We took out full-page ads in the newspaper. That's this carta abierta, the open letter to the parliamentarians, where we cited the data from Candies in Hell. 1 out of 2 women have been abused, et cetera, et cetera. And underneath it says, therefore, I demand that you pass the domestic violence law. And in 2 weeks, we got 16,000 of these and stuffed them in the mailboxes of all the parliamentarians and sat out in front and took over the seats in the galleries and went on to TV and said, you know, don't forget we vote. Elections are coming in a few months. We're going to remember who voted for the law and who didn't. And very interestingly, the law passed unanimously within a month. So that was a big triumph. That was in 1996, just 1 year after Beijing conference. So that was really important for me because that's where I realized the power of mobilizing social movements and the power of research, combining research and activism together, and how incredibly powerful we were as researchers by putting our data and our findings in the hands of activists, by doing the research together with them so that they could use it and, you know, use it in a very compelling and effective way. Our research was actually in the preamble of the law. It's still cited in the preamble of the law. After that, I started working with the World Health Organization and another group of researchers and also activists from all over the world to do a multi-country study. So we knew, we'd seen some data from one colleague had done a study in Zimbabwe, there was another one in South Africa, mine in Nicaragua, and from that experience we put it all together and did the same study. We did a similar study, much more detailed and complex, in 10 countries and 15 sites. So over about a 5-year period, we interviewed over 24,000 women about their experiences of violence. We also developed safety guidelines, which you can find online at WHO. They're considered now the gold standard for safe and ethical research on violence against women and girls. And we also have specific pieces for research on trafficking, research in conflict settings, research with perpetrators of violence. And the main bottom line of all of this is women's safety has to be put first. You cannot do research in a way that will compromise them either physically or mentally, or their emotional well-being, or re-victimize them or traumatize them from just the memory, remembering and reliving these experiences. And we also have to watch out for the researchers, and that's something that we learned that, you know, even for me, but also most of my staff had experienced domestic violence. And in fact, Ana Cristina was one of my field interviewers, and it was this whole story came out during one of our debriefs with the staff, and then she became part of the qualitative study. So that became incredibly important. So we developed a whole bunch of different measures of dummy questionnaires, making sure that we always did the interviews where nobody else could hear. So that might be going out into the patio, it might be going where women are washing or where they're doing their farming, to be able to keep away from others and nobody could hear about it. If somebody else came in, we would stop, and if we couldn't get rid of the person through the dummy questionnaire asking about, you know, breastfeeding or vaccination or something, then we'd stop. And we'd try and come back another time, and if we couldn't, we'd stop. So the bottom line was, if you can't do this safely, you have no business doing research on violence against women. It's not like research on diarrhea. It's not research on vaccine. It's life and death for people. And coming into their homes and asking them about these things, they need to be able to trust you and know that it's not going to It's not going to harm them. And in fact, we found that most women really welcomed being asked. It was the first time for many of them that they'd ever told this story to anybody. And it was like a huge relief. And a lot of them said that they just felt lighter afterwards, having been able to talk with somebody who wasn't judging them, somebody who really listened to them. So the, sorry, that's my phone. It's my father calling to see when I'm coming. I'm busy, Dad. Where was I? Ethics. So, yeah, so anyway, after that, this research started to take off. So you see in 1995, which is when I did my study, yeah, there was just a tiny handful of population-based studies. But by now, and this was just up to 2010, there have been hundreds and by now thousands of prevalent studies in over 90 countries. Measuring different forms of violence. But also the other problem is that we weren't measuring in a systematic way. So the fact that we developed a questionnaire that could be used in different languages and used in different contexts and different cultures was also really important, because before that you couldn't compare the data. It was apples and oranges. Somebody just did sexual violence, somebody lumped it together with emotional violence. Nothing was comparable. So after that, the World Health Organization and the London School of Hygiene and Tropical Medicine did a global burden of disease study, and they're doing a renewed one right now, which is where they found out that 1 in 3 women in the world has been physically or sexually abused. It was more or less what we calculated before, and actually it came down right on that. But that doesn't mean that they're all the same. There are differences even within countries that are neighbors to each other. And some regions, like the Pacific, where I've been working now in Melanesia, the rates are much higher. They're twice the global averages. And in South Sudan, where we just completed a study on violence against women, intimate partner violence is suffered by 3 out of 4 women. And 1 out of 3 have been raped by a non-partner. So finally, in the global scene, we've been having a similar kind of problem, which was that when the Millennium Development Goals came out in 2000, we wanted, for the gender equity goal, we wanted there to be a target, a standalone target around ending violence against women. And what they said to us, and this is now, if you look back at 2010, there was not that much evidence. And they said, oh, you can't have a target, you don't have an indicator, you don't have enough evidence, there's not enough information. So again, that's part of what the women's movement and what researchers, what we spent a long time doing was presenting this evidence. And now that we've done it, and we can say, okay, here you are, this is like a very serious health and human rights and development program problem. Now it is a standalone target in the Sustainable Development Goals. And that is really important because all countries have signed on to that, and almost all. And so you can go to any government, any country, and say, your country, your government has said that they're going to work on cutting the rates of intimate partner violence, and you need to gather more evidence, and you need to have programs in place. So that's a huge moment that was only 4 years ago. So really, it really only became recognized as an international problem sort of generally 4 years ago. But then we're sort of caught flat-footed in a way, because everybody says, we spend so much time convincing them, and then everybody says, okay, we get it, so now what should we do? And really, there was not very much evidence about how you prevent violence. People have been working a lot on laws, and there are over 100 countries now with laws on domestic violence, also within the last 2 decades, most of that within the last decade. But nobody's really evaluated them to see how they're doing. We don't know very much about how effective services are. We know they're vital for women who are experiencing violence. We don't know if they have any kind of, they or the laws have any kind of deterrent effect. We know that batters interventions do not work. That's one of the few things we know that doesn't, because it's been studied dozens and dozens of times, and the same answer keeps coming up. So now we have this real challenge of how do we start developing prevention, particularly primary prevention programs and what's the best way to do that. And I'm not going to talk very much about this because Clea is going to be talking about this in the next session. Right, Clea? Yes. So all I'll say is that we now have more evidence than we've ever had before. We're still missing a lot. But several programs, including many of the ones that both Clea and I belong to, an initiative funded by the UK government called What Works to Prevent Violence Against Women. She's been working on an RCT around self-defense for girls. I've been working on research on conflict settings. But several of the studies found as much as 50% reductions over literally like a two-year period. So we have programs that are working specifically on relationships. We have programs that are empowerment for women or working specifically with men. We have community-level programs like SASA, you may have heard about, that reduce violence by 50% in a full community. That's the only one that's been population-based. So the problem is we know specific projects that can work, types of workshops, methodologies that you can do for communities, but that's still really small. They're kind of boutique projects, and they're mostly carried out by the women's movement, by very dedicated NGOs. It's not really clear how you would turn those into a government program, or how working with couples is great for those couples, but you can't work with every couple in Rwanda, which is where they've been doing that study. So the other side of the question is, how do we work at a scale that can really achieve change at a national level or at a regional level? And that's where I decided to go back to Nicaragua and see what had been going on. Because, and so we called it, because it was right after Beijing Plus 20, we called it Candies in Hell Plus 20. Which means nothing to anybody outside of Nicaragua. But in Nicaragua, everybody loves that name. And the idea was to see what's happened in the last 20 years. What has been the impact? Because we know what's happened. We knew that the women's movement had been mobilizing. They'd been holding the government accountable, a whole series of governments, both from the extreme right to conservative, and then the Sandinista government, which came back into power in 2007 as a sort of leftist government, which it's veered off of. So anyway, we wanted to see there were national programs, there were women's and children's police stations, just so much had happened that we thought, okay, if any place has reduced violence, it would be Nicaragua. So we went back to Leon, the same city. My same researchers, colleagues that I'd worked with 20 years ago were still there. We even saw some of the same field workers, interviewers. And we did a follow-up study using the same sampling frame and the same basic questionnaire. We used the WHO questionnaire this time. And we interviewed this time 1,400 women. And we used ages, it says 14, I don't know why I haven't fixed that one yet. It's 15 to 64. We wanted to have older women because we're also interested in looking about, going beyond women of reproductive age, which has been really the only group of women that anybody has cared about for a very long time. And a lot of researchers feel that it's time to expand that. And because that group of 50 to 64 would have been eligible for the last study. And in fact, a couple of field workers, interviewers, told us that they'd gone to a house and they started asking the woman these questions. And she's like, somebody was here about 20 years ago asking the same questions. So we got even a few of the same women. We also did a whole component qualitative piece to this, and I'm a really strong believer in mixed methods. I think you can only go so far with quantitative, and often you get really interesting results, and then you're like, I wonder what that meant, or what is, you don't know what to do with it, because it looks great, but we don't know how we actually got it. We don't know what the mechanisms are. So we did a lot of interviews. We worked with the women's movement and constructed timelines of, this was like a 5-year period, you can see up there, of all the things that had been done over year by year. We just constructed the whole 20 years and all the laws that have been passed and all the programs and all the centers and the ups and the downs. The bad things are on the bottom, the good things are on the top. You can see there's more good things. We were not able to interview government officials. This is in 2016, and presidential campaign was going on. And Daniel Ortega, who is running for president now for the 3rd time in a row and had changed the Constitution to be able to do this, he put his wife, Rosario Murillo, as the vice president, who is presumably the person who would be sort of relieving him and really moving into sort of a dynasty dictatorship. And they were closing down information altogether. So we couldn't even talk to a nurse in a tiny little health center off in the rural area of Leon without her getting permission from the Minister of Health in Managua, who had to get permission from the vice president. So as you can imagine, we didn't get very many permissions. And we got, basically were able to interview some people just because I knew them personally, but it was off the record. So we were already beginning to see that spaces and collaboration with civil society was already getting getting tight. And I'm going to tell you what we found, which was pretty exciting. We found that intimate partner violence, physical and last year, was reduced by, it says nearly half, but it was actually more than that, as I'll show you later on. So from 52% to 28% in lifetime physical violence, which you wouldn't expect lifetime violence to, everybody who had it, the 52% up to a certain period, they're not going to unhave it. So that really means that the younger people probably have reduced by even more. And when we look at 12 months, it went from 27 to 8%. That's really stunning. Interestingly, lifetime violence did not go down very much, and emotional violence was still quite high, 43%. We compared them to the demographic and health surveys, which I'm sure you're all aware of, the DHS. There had been 3 of them done during this period, and I actually helped develop and analyze the 1998 one. And so you can see the trend is the same. So the first and the last, the green and the purple are our 2 studies, and then the DHS. And here I isolated out the findings just for Leon, not the national findings. In 1998, just 2 years after this one, they had less than half of they found less than half of what we found, and less than what we actually found last year in 2016. And that's pretty typical for DHS and their modules on domestic violence. They're in the midst of these big, large studies on HIV and maternal mortality and nutrition and diarrhea and breastfeeding and anything you can think of. And then at the end of it, they say, oh yeah, and have you ever been beaten by your husband? It's just, they're not well trained, it doesn't make sense. You usually get very low disclosure, and that's what we have been seeing in Nicaragua. But it was important to be able to say that the trends were similar. So I'm going to talk a little bit about other things that we found. Sexual violence had not gone down. That's actually similar to what we found in the United States and in other places, where physical partner violence has gone down, but not sexual violence. And we actually did many more questions on sexual assault this time than we had. So now we know a lot more about harassment and on buses and public spaces. The sexual electronic content was a new thing, and we did it by age groups and found, not surprisingly, that that's very concentrated among young women. Rape and attempted rape were 9% and 6%, and altogether, if you put together the sexual partner violence and the non-sexual, and some women have all of them, almost half the women we interviewed had experienced sexual assault by a partner or non-partner. So it's not like they're out of the woods, but there was a very strong change in this one area where there had been a huge amount of work. But it just reminds us that in terms of preventing sexual violence, it is not the same necessarily the main measures that work for domestic violence. I'll say a little bit about risk and protective factors and what we found. So basically, this is using multivariate analysis and using odds ratios, which I think you've probably all had basic epi. So basically, women who were disabled, who had been married before the age of 18, who were living together but not married, and who lived in the urban area, had 2 times greater violence than women who did not have those conditions. And in terms of partners, if the partner was beaten as a child, or the partner used alcohol, problematic alcohol use, they were also 2 times more likely to beat their wives, for their wives to have experienced violence. We've also found some protective factors, 2 very important ones. One was being young, which we already suspected, that there was some kind of cohort effect and the young women were experiencing less. And women who said that they had family support from their birth families, that they had somebody, basically somebody who's keeping an eye on them, somebody they can talk to, somebody who will support them if they need help. That is consistently a protective factor. And that's point 2, which basically means that those who don't have family support have 5 times greater odds of experiencing violence. And then women who had either been sexually abused in childhood and women with high parity, more than 4 children, and we had this also in the first study, were 4 times more likely to have experienced violence. So though we had pretty clear sense of risk factors, which were more or less the same as what we'd seen the first time around. We also had some really important findings in terms of violence and reproductive health. So I said already that the women who had 4 or more children were more likely to have had experienced violence. And we also found that 10% of women had experienced violence during a pregnancy. And then, so why would that be? At the beginning, people were saying, well, yeah, women who have had a lot of children, they're nagging, they're less attractive, the husband's cheating on them, that somehow having the children was a risk factor and was causing the violence. Well, we did some other kinds of pretty sophisticated analysis using survival analysis, and we found that violence starts very early in the relationship. 80% of the violence starts within the first 4 years, and 50% within 2 years. So that's before she started having children. So now we really see the high parity as a result of the violence. And that really makes sense with what a lot of research by Liz Miller and Jay Silverman and others have done around reproductive coercion as another form of domestic violence. And some of these are those types of acts that are covered. So if a partner refused to use a condom, again, these are odds ratios. Why can't I get rid of that? Sorry, let me try again. There we go. She was more likely to have had, some of these would be more risk factors and some of them would be more consequences, and you can sort of see logically. Women who have experienced violence are more likely to have had an abortion, 2.5 times more, twice as likely to have had a miscarriage. And this is in a country where abortion is completely illegal, even in case of the mother's life at stake, or in the case of incest and rape. She is less likely to use birth control, and she and her partner are less likely to say that the pregnancy was wanted. So we're imagining that there's a pretty strong impact of reproductive coercion there. So I think I have convinced you that violence, that we had some pretty big changes over time. But the first question we want to ask is this a real change? The first thing when you're looking at it, what would you be thinking? What might be causing that change? Any ideas? What did somebody say? Education. It could be that girls are more educated. Anything else? Could be economic development. Yeah? Oh, it could be underreporting, so it could be that women are just not disclosing it anymore. Anything else? So there could be some kind of change that has to do with social norms, right? Or awareness or something like that. So that's what we were trying to figure out. And the first thing you want to eliminate when you're doing a study like this, you want to eliminate the demographic piece. If you control for education, for example, or for age, and the whole thing disappears, then really this is just a product of development. It's not a real change. So we had to do that analysis first. And you can see here that there are a lot of demographic changes. Our population was older, which meant that, wait, how does this go? Yeah, the blue is the new ones. They were much more likely to have high school or university degrees. They were much less likely to have more children. they, interestingly, were more likely to live in the rural area. And this is because the urban area became so congested that basically there was a lot of development outside. So the rural area actually grew. And that was an area where there had actually been less violence. And our hypothesis is that it has to do with sort of general social violence in urban areas, because often you don't have this. You see the opposite. And the population of ever married, because this is all ever married women. The girls who haven't been married or partnered are not included. And so that means that girls are getting married later as well. So that's one thing that could be, any of those could be the reason. But we look at, let's see. What am I doing? Come on. I should be, oh, here we go. Got it. There we are. So then, before I started doing anything else, because I didn't have the 2 data sets, I started comparing them by age groups. And if you see, in the first round, age was not associated with lifetime violence. And that is crazy, that the 15-year-olds had as much violence as the older women, because you're talking about a lifetime of exposure, basically. Older women have been exposed all their lives. But this is related to the fact that the violence starts so early and then just lasts forever. But look at the purple, which is the young women. So now, when before, 45% of young women, 15 to 19-year-olds, had experienced lifetime partner abuse. Now it's 10%. And all of this is highly significant. So we're already now getting an idea that definitely something is going on here. And now I'm going to prove it. So then we did, and this was really complicated. This little slide took me almost a year to put together, because to really show a real difference and to control for all these things, you need to have a pooled data set. So you need to be able to combine the 1995 data with the other into one data set and then do multivariate analysis. And the problem was that I did this in 95. I did it over 20 years ago. Since then, got divorced, moved, lots of boxes, things got moldy, and we lost the data set, which was really crushing. So all I had was the printed data and what was in publications, and that's what I was using to compare. But when I was in Sweden at my old university for something else, I mentioned that I'd lost my data and how upset I was. And they said, well, we never throw anything away. Why don't you go look in the closet in the attic and see what you can find? And I went around and I found the Mary's Leon data box. And I took it home and we re-entered it all, and it didn't come out exactly the same. That always happens. Something was off, but it was very close. The findings were basically very close. So then we did pooled analysis, and we controlled for age, education, parity, residence, and family support. And basically, you create a dummy variable, a variable that just basically says which study it was in, the early study or the later study. And that's what you're looking at as your independent variable. So this is now adjusted odds ratios from a pooled data set. And what you can see is that lifetime physical violence went down 50%, compared to after controlling for all the demographics. And 12-month physical violence actually went down 70%. Which is kind of amazing. And then, as I said before, lifetime sexual violence did not have a significant decrease. So I've now convinced you, I think, that it changed. The next piece is why. And I'm running out of time, so I'm going to zip along here. I'm sorry, I just get so excited talking about this data that I just can't stop. So why did it decrease? And now we're coming back to the idea that things changed. People's ideas changed. And why did they change? Well, first of all, there was the first law. So all those girls grew up in a country where it was already illegal to beat your wife. It was against the law. It was not against the law when we did our first study. So that's got to be profound. And then there was another law that was very polemical. There was a lot of controversy in 2011, another law by the women's movement that was now against femicide. It was much broader. And there was a lot of backlash against it. So basically, everybody knew about it. And we found out that 90% of the women in our sample, including very rural areas, knew about Law 779 by name. And they could say what it did. And 80% of them felt that it helped women. The 15% who think that it harmed women is because some people said that they were afraid that men would start murdering women more. Well, if I'm going to go to jail anyway for beating you up, I might as well just finish you off. It's kind of like an urban legend. Definitely there were people who felt that that was probably happening, but we didn't really see any evidence of it. But look at, from our qualitative data, the difference. We had men tell us the first time around how to beat your wife so that you don't get in trouble with the law. You do it with your machete on the flat side. You don't do it in her face where it could be seen or leave a scar, and you don't use the sharp end of the bush knife because that will get you into problems. Basically, that's how they explained it. And now we talk to people, and a woman says, my neighbor said, you know that men can't lay a hand on a woman. That is not allowed. And this kind of like, that's not allowed was a whole new discourse that we hadn't heard before, because it was allowed. We found that women were going for help more. If in '95 only 1 out of 5 women had gone for help for anybody, now it was 1 out of 3. And 33% had gone to the police or to the courts. And that's a function of the women's police stations. I am just having trouble finding the spot to click. Sorry. There we are. Let's stop messing with it. But no, it's not doing it. I'll try again. Attitudes among the police had changed a lot. At the beginning, they used to send women home, and now they were helping them. There were social workers. There were people to trained women police who could help them and the children. So just people were talking about it in a really different way. There had been really important edutainment programs. So education, entertainment. So basically soap operas that deal with social issues. And one program called Sexto Sentido was watched by 70% of the women in our sample. It had a huge viewership, is that what we say? Audience segment. And the campaigns, a third of the women remembered campaigns that had happened during the 90s and could remember the names of them. So clearly that had a difference. And where you can see the difference is in when we asked about when people thought that it was acceptable to beat your wife. And see, before, these were the kinds of reasons that people would give. And look how much down it's gone from 15 and 14 down to 2% or 5%. And altogether, before, when 38% believed that there was at least one reason why a man could beat his wife, now it's down to 8. That's a big difference. And finally, and then I'm going to take about 5 minutes for the epilogue. Is that OK? We found Ana Cristina again and asked her about her life. And she'd had a tough life. She'd been a law student at the beginning when we met her. But with all the difficulties of raising her children alone and being so traumatized, she ended up basically selling tamales for the rest of her life. She was very poor, very worn out, but her daughters one was a lawyer and the other was a doctor. And she felt really optimistic about their lives. And the way she talked about it was, again, women don't put up with this. This is different. Now violence is something that, we all know you're not supposed to do. So now I'm getting to the other piece of it. While we were doing this, as I said, Daniel Ortega was becoming president again. He really had it in for the women's movement because his daughter had accused him of raping her since she'd been a child, and the women's movement defended the daughter. And he started really persecuting women. And his wife, who's now vice president, had very conservative views about families and family unity. And there's always this discourse about individual human rights and women's autonomy and keeping the family together. So funding and collaboration with the women's movement went way down. The police stations, while we were doing our field work, stopped. They ended. They were closed. And how did we find out? Because one day they'd painted over the signs. They didn't even announce it. There was just they closed the door, they painted over it. And we found out eventually that they had gotten rid of all the social workers and all of the women were reassigned. So just in one brush stroke and without saying anything, they just eliminated it. Here's an example of a rural police station. So when there were 50 in 2012, by 2017 there were 0. And shelters went right down. So the end of this part of the story is incredibly hopeful, and I've told it in different places, and it's a wonderful story because it's the first time we've seen that in one generation you can cut violence down by 70%. So many people say it's completely intractable, a place where there's so much machismo and women are so dominated, you can't just change that. Well, now we know you can. And what you need is a really strong women's movement to hold governments accountable and to tell women about their rights. So that's the good news. We got all ready to present this in April last year. And what happened on April 18th was that students started demonstrating against the government around a pension change, and the police, the ones that we were saying such nice things about just like a few slides ago, started shooting at them with live ammunition. And hundreds of people were killed and thousands wounded. And then people started leaving. They started building barricades and closing down the cities. And then the police went in with tanks and with guns. They kept a bunch of students all night long, shooting at them in a church and not letting them get out. And so pretty much everything I just told you is no longer there. And that's 30 years of progress. So part of it is just how fragile this is. Yes, it can be done, but it's not a technical problem. It's not an investment problem. It's a political problem. Women who were so well organized and were one of the strongest social movements have been absolutely in the forefront of the work of the resistance. Most students who were involved are now either in exile, or they're in jail, or they are dead. And among them is this boy in the middle is my son, Julio, who was living in Nicaragua when the shooting started, and he was in the church when they were being shot at. And he came to the United States and then started doing, he's basically in exile. He can't go back until this is over. And health workers were incredibly affected by this, because once these wounded kids, students and protesters started being taken to the hospital, the Minister of Health had a blanket order that the hospitals were not to attend the wounded. And so on the second day, a 15-year-old boy named Alvaro Conrado was taking water to the protesters and got hit by a sniper in the throat and was refused help at a hospital and then died on his way to the next hospital. So doctors and police and medical students started setting up clandestine first aid centers in homes and in different places. And as a result, hundreds of them have been fired, including some of the most distinguished physicians and specialists in the country, and including some of my co-authors from Lyon Medical School who are also now in exile. And including some amazing medical students like this young woman, Amaya Copens, who was a student leader in Lyon and a medical student, and was arrested 8 months ago, and she is still in prison. She's one of the last. She's a Belgian citizen and Nicaraguan, and the Belgian ambassador and the European Union came and could have gotten her out, and she refused to go until the rest of her inmates, her prisoners, were let free. And that is, in case you're wondering, those are not scrubs. That's a prison uniform. So lest we start thinking that this is just something that happens really far away and does not affect us very much, it's time to remember that it does affect us, that we are suffering the same backlash. We have a sex offender in the White House. We have sex offenders in the highest courts of the country. And survivors are still not being believed. This many years later, 20 years after, 25 years after the Violence Against Women Act. I had an incredibly surreal experience because I'm sure all of you were glued to the television when Dr. Blasey Ford was giving her testimony. And as that was happening, I was in a meeting with some friends and we started watching it. And as it was happening, I realized that my son Julio is on the other side of the hill, of Capitol Hill, speaking to the Lantos Human Rights Commission of Congress about what's going on in Nicaragua. And so that's me over there watching both of them at the same time. And the words that a mother never wants to hear her son say is, "We're just trying to stay alive right now." So what do? We are scientists, we are health professionals, we're physicians. What is our role in all of this in a time of this kind of magnitude of crisis? Is it enough just to be doing our research? Is it enough just to be dealing with the patients that we see and helping them one by one? In my view, we have to do more than that. And this is my second to last slide. I was during that same period at a meeting on sexual assault at the National Academy of Science. So the same day that everybody else was putting out their signs, we also went out in front of the National Academies of Science. And those are most of the major, international, most distinguished academics in the area of child sexual abuse, saying that we believe her. And then 2 days later, when he was still being confirmed, so you use your science, you try to influence people, and then sometimes you just need to get on the streets. You need to just go onto the steps of the Supreme Court and say, this is not right, and I'm going to stand with the social movements, with the women's movement. So I think that's really important. And what I'd like you to do after this, when you go home, is just think about it. We all have a lot of power. And think about the different kinds of power you have, and what is the power that you personally can use to help end violence against women, both in our community, in our schools, and abroad. Thank you very much.